I've studied workforce well-being for many years, and I'm really encouraged to see this topic now receiving the attention it deserves.
And what keeps me awake at night is how to take care of the people under my charge so that they can take the best care of our patients.
To attract young talents and combat the skills shortage, we must create workplaces that truly value and support those who commit to this profession.
Healthcare depends on the resilience, skill, and dedication of its people. A career in healthcare is deeply fulfilling, but rising workloads and increasing demands make it harder for healthcare professionals to deliver care and find satisfaction in their work. To ensure a sustainable future, we must create workplaces where healthcare professionals feel valued, supported, and equipped with the right skills and technology to thrive. A workplace that prioritizes its people makes it easier to attract, motivate, and retain talent. When those at the heart of patient care have a better work experience, they drive innovation, enhance care quality for their patients, and build a more sustainable healthcare system. Join me in this SHAPE Spotlight as we explore ways to empower today's workforce for tomorrow.
Workplace well-being is fundamental to healthcare delivery. It directly impacts job satisfaction, productivity, engagement, retention, and ultimately the quality of patient care. These aren't abstract metrics. They define healthcare effectiveness and long-term business success, certainly for us here at Mount Sinai and for our almost 48,000 employees. Addressing this issue requires more than awareness. It demands organization-wide commitment and a strategic, structured approach, one that's realistic and includes actionable solutions. We focus our efforts on workplace culture, workplace efficiency and function, personal factors, and mental health. Workplace culture means a sense of shared beliefs where people feel valued, supported, appreciated, and respected. That's why we invest in a number of initiatives to enhance that, like employee coaching, education programs, communication tools, and role modeling. Being able to work efficiently in the workplace is closely tied to finding meaning in one's profession. We support the health and personal well-being through a variety of initiatives in partnership with those who can provide counseling, consultation, and wellness programs. And we work hard to be aware of symptoms of mental health problems to direct support where it's needed.
We have a commitment to care for good. And this aspiration also translates to our commitment to care for our own employees. What we as leaders can do right away is to start listening to our staff and acknowledging their efforts and achievements, big or small. I'm proud that we made the decision to invest in developing and enhancing our in-house clinical training programs, allowing for a more structured and effective approach, promoting clinical confidence, and achieving consistent, high-quality outcomes. This also required us to take working bodies out of the roster to commit to extended training, which was also a tough trade-off. Our employees have been empowered to create topical e-learning modules that can help everyone improve their clinical knowledge in bite-sized portions at their convenience. Medical companies can also help accelerate our learning and development through platforms such as the Siemens PEP Connect, a personalized online education experience that aims to increase competency, efficiency, and productivity. People are our greatest asset, and when they feel supported, valued, and engaged, they're better equipped to provide the kind of care that you and I would want to receive as a patient.
In radiology, today's increasing pressures and demands often limit our ability to recharge, to think creatively, and to work efficiently. Reducing pressure starts with freeing up time in radiologist schedules, helping them to regain a sense of control. We do this by using assistant staff or non-interpretive tasks, such as reading room coordinators. There's opportunities to streamline workflows. We can see this happening prior to the exam actually being started, during the exam, and during the interpretation. With interpretive assistance from artificial intelligence, we can be prompted to look in areas that we might ordinarily miss. We also can have artificial intelligence perform mundane, repetitive tasks that really stress us out and really make us tired. As efficiency improves, it's important that the time saved is not used just to increase caseloads. People need time for a break.
Staff shortages present a major challenge for full-service lab providers. To attract young talents and remain future-ready, laboratories must offer an engaging and attractive workplace. It's not just about efficiency. It's about making work more fulfilling. For us at Medicover, automation plays a key role in this transformation by taking over repetitive tasks such as centrifugation and aliquoting during pre-analytic processes. Automation streamlines workflows and improves efficiency. Automation and robotics can also create a safer workplace by reducing contamination risks. Today's professionals seek employers whose values align with their own. At Medicover, we included employee well-being in our global sustainability program, making it a priority across the whole organization. By investing in people and technology, labs can shape the workplace of tomorrow and create an environment where employees want to stay and grow.
At Mount Sinai, our goal is to teach coaching strategies at all levels. We teach approaches that encourage communication, strategic questioning with team members, and techniques that utilize emotional intelligence. Over time, this type of approach can contribute to a solution-focused culture. What I mean by that is a working environment where issues are addressed directly at the level where they arise, rather than a culture of relying on others to provide solutions. This paves the way to generate new opportunities, strategies, and improvements for the entire organization, instead of simply managing daily challenges and putting out fires.
By empowering individuals, strengthening teams, and transforming organizations, Siemens Healthineers contributes to a future where well-being, efficiency, and innovation go hand in hand. To keep pace with evolving demands, healthcare professionals need flexible learning solutions. We provide hybrid education from immersive virtual experiences to hands-on training. Empowerment is also about having the right support when needed. Our real-time remote services provide immediate expert guidance and support, helping individuals stay efficient and focused. In addition, our remote scanning and reading solutions enable working from home while maintaining the highest care standards. We develop human-centered, intuitive solutions that simplify complexity to strengthen teams across all skill levels. AI-powered tools like My Exam Companion provide intelligent guidance and automation, making advanced imaging technology easily accessible. This includes technology innovations like our recently extended photon counting CT family, the Neotome Alpha class. In diagnostic labs, automation and robotics improve efficiency by taking over tasks like cell counting in fluorescent microscopy, or sorting and decapping sample tubes, allowing specialists to focus on more meaningful, high-valued work. But technology alone isn't enough. Our FlexForce staffing solutions help address immediate and chronic workforce shortages by providing fully trained staff. Ultimately, long-term success demands a strategic approach to organizational transformation. Our consulting services help organizations rethink workflows, optimize resources,
and create human-centered workplaces that drive efficiency, well-being, and a better daily staff experience overall. Empowering today's workforce for tomorrow is more than a vision. It is our commitment to shaping a healthcare system where people and innovation thrive together.
The responsibility is ours to empower individuals, strengthen teams, and transform organizations.